please, everybody come on up, and we're going to have about 15 minutes for discussion. Just to start, a little commercial from the Office of Dietary Supplements. I urge you to take a look at our website at NIH. We have a wonderful group at the Office of Dietary Supplements, and we rely on many of you in this audience to review fact sheets that are put out for both consumers and professionals on dietary supplements, and they're really wonderful resources. They're free, they're paid for by your tax dollars. Another wonderful resource, federal resource, is the Uniformed Services University of the Health Sciences has a lot of very good materials for performance of warfighters. They're particularly interested in our military, and I urge you to take a look at them too. So I think it's time for some questions. Let me start with one that's been concerning me a little bit, Duffy, and thank you for your very good presentation. And that has to do with dissolution and disintegration, not of those of us in the room, but of dietary supplements. And it was brought up to me by Nancy, who mentioned the whole issue of absorption. And one of the reasons why some products may not have any effects is because they're never absorbed to begin with. They're what I think is called in the geriatric trade bedpan bullets. And wondered if you could talk about industry efforts in the respect of getting better dissolution and disintegration.
Sure. I think one of the things that we recognize is that when studies are, an expensive, large study has been started, it's the importance of biomarkers of intake and status to be done baseline and throughout the study for a variety of reasons. So that then the product in that study had an influence on, it was absorbed, if you will. The other issue is that there are monographs. For example, USP sets monographs for like the vitamins and minerals. Most of them are made to a USP standard, which means that you set specifications, you test to those specifications, and one of those specifications does include dissolution. And so the company has to make sure, if they want to meet the USP standard, that it dissolves based on how they have defined dissolution. Is that perfect? Absolutely not. Is it apply to every form that's out there? Like, one of the challenges we've had is the dissolution standard is based on tablets and capsules, but now we have other delivery forms, and sometimes they don't meet that standard, but they actually have studies to show that the material is absorbed. So something that the industry is aware of, but again, there's no single solution. And the responsible companies, when they're marketing based on, if you ever see a claim that says absorbable, more absorbable, bioavailable, as soon as you make a claim, you have to have the evidence for that claim. For example, I've been in charge of an NA case where someone came out with an omega-3 where they say twice as absorbable. And we said, what's your evidence? And it turned out, they had some CACO2 studies, et cetera, but when the experts looked at it, they said, no, this does not equal twice absorbable, modify that claim. So that's how it's addressed. It's not a perfect situation, but awareness is there.
Thank you. Do we have a question? Yes, we do. Nancy.
Thank you. Very interesting talks. Could you, Tim and Doug, talk a little bit more depth about the types of research that industry has, been very effective in supporting, and perhaps areas where, looking ahead, the industry maybe could focus on?
Sure. What is of most interest would be something that you could patent, make a product, get some financial security around. I think historically a lot of that has come from the bioactive research, the components of elements. They look at a healthy diet and say, well, it must be high in bioflavonoids, or it must be high in curcumin, or some element, and then they extract that, and then they give that as an individual dose to see if it has the desired effect. The challenge is that a lot of the research questions are related to disease outcomes. You know, does it affect blood pressure? Does it affect GI conditions or symptoms? What about a Crohn's patient? The difficulty then, it may in fact be effective, but the difficulty is that the FDA says if this is a disease outcome, it can only be a drug. It can no longer be a food. And so this is a regulatory paradox that we deal with routinely as we're getting into areas where there may be therapeutic value, and we maybe now have the mechanisms and the tools to look at more sophisticated tests that are showing that this might be effective at the physiology level or the cellular level. But our regulatory paradigm still says, well, I can't believe that Alzheimer's has any different nutritional requirements on a population epidemiologic basis, so therefore there's no justification for a medical food for that. That's, you know, those are some of the specific areas, but there are areas like, you know, in the infant formula that I mentioned, where 10 years of research showed that specialized formulas could actually be beneficial for babies. And it took 10 years for that evidence to be compelling enough to get a qualified health claim.
I'll give a real quick example. Physicians Health Study 2, it was talked about here today. That's the one that showed the cancer risk reduction. There was 4 arms to that study. There was cancer, eye health, cognitive health, and I'm forgetting the 4th, cardiovascular disease. Companies stepped up to the plate, provided multivitamins to 11,000 physicians for 10 years, put into blister packs, spent lots of money, and no guarantees on the results. You know, asking questions like, will a simple multivitamin reduce your risk for heart disease? I would have been really nervous to put 10 years of product on the line. Heart disease is a multifactorial condition where we have cutting-edge treatments for, and you want a simple multivitamin to be an additional benefit on top of the state-of-the-art treatment for heart disease. That's a pretty heavy lift for a multivitamin. And a company said, no, we're going to do this, we're going to put the money in, and we're going to live through the outcomes when folks get up on the podium and say, oh, you don't have to take a multivitamin, no benefit. You know, and really there was benefit. There was significant benefit to cancer risk reduction. There were some endpoints for eye health. And we as a trade association have paid for a secondary analysis of that data to see if people within that cohort that had poorer diets or better diets had different outcomes. So industry is willing to put the money forward, and you know, that's how it works.
Thank you. We have a question from Kathy Weaver.
Well, kind of more of a comment, just to kind of build on what you're talking about, Tim, just from a Kathy Weimer from General Mills. I would say certainly from a broader food industry, the importance of funding research to better understand the impact of components and nutrients on the population is something that certainly we as a company have felt has been very important over many years. And using the example of whole grain, we really decided very early on, even before it was officially part of the dietary guidelines, that that's an area that there's huge gaps. We looked at the research, and obviously being a grain-based company, it became one of those things that we helped establish and seed money for researchers to look at this question. And I think it's helped build the level of data that's available to help create a better understanding. We don't have all the answers, obviously, on the relationship to health, but you know, it certainly impacted then how we thought about our products and what we then changed in our product portfolio, particularly in our cereals, to really offer more whole grains. So I think, to your question, that, you know, the food industry tries to look at these issues and problems and gaps and see, okay, do our products currently fill? Do they, could they fill? And then, you know, is there a way that we, you know, can accomplish that? And certainly the consumer piece is a very important aspect of that. Will they accept it?
Thank you. Dr. Tahiri.
Thank you. I'm bringing another aspect of research that's actually it's something that we face every day and that I think the industry can bring a lot of expertise in is consumer research. We face the consumer every day. We interact with our consumers every day through our products, through our practices, and I really believe one of the gaps in the dietary guidelines is that people do not follow them, and we have a lot to understand in terms of what are the barriers and what are the motivators. And I know a lot of companies do that. So beyond the consumer research that we do that are branded, that's not what I'm talking about. I'm talking about a lot of the consumer research that we do that are ethnographies, and we focus on, for example, in General Mills, and we have shared this with a lot of groups because we think it is not competitive. For example, we would do ethnographies, and we would be very happy to share that with anybody who would be interested on low-income consumers or approach to weight management. And when we do that, and we have an anthropologist in the company who's working on really understanding what motivates people to lose weight, and how did that evolve over the last 15 years. And they are motivations that are absolutely different. What actually for a mom that is from a who is a low income family, what qualifies as a healthy food? And we have the conversation with her, and she said, pot pie. And we're like, what? And she's like, what's wrong with you people? Pot pie, it has dairy, it has starch, so it has vegetables. So when we say eat fresh fruits and vegetables, to a mom in that situation, we're not hitting the message. So these are the kind of things that I think the industry, in terms of research, can bring in and probably improve the effectiveness of the dietary guidelines in meeting the heart and the minds of consumers. So I really see that there's an opportunity for us to share some of our knowledge in knowing consumers and what motivates them, in really reaching what we all want is for them to follow the dietary guidelines. So I would love to have a comment from the audience on that.
Specifically, could you speak to the issue of panel of people say 70 is the new 50? Okay, but is it really true?
We agree.
Is it really true that 90 is the new 70? Given the information we heard from Jennifer Maddens yesterday and so forth about the disabilities and so forth, because it seems to me this is relevant to Dr. Tahiri's question of consumers.
So the answer is maybe. I think there are three factors. One is kind of how well you take care of yourself. And that does include nutrition, it includes exercise and other lifestyles. Second, I think, is genetics. There's a very strong genetic influence on what diseases that you will or will not develop. And I think the third is luck. I think we discount the importance of luck in terms of our health. But in fact, I have a number of patients in their 90s who are still working. It seems to be artists. Artists seem to do better than business people in their 90s. But in fact, they are working and they're still very productive. A lady who's 98 years old and she's still painting and she's selling her paintings. So.
Terrific. Okay, we've got about 1 minute, so it has to be a 30-second
Very quick for
question.
Tim. Thanks for reminding us about the diversity of the food and beverage industry. I would just say that we need to temper some of the positive findings you presented, like the Healthy Weight Commitment Foundation, the third-party evaluation that UNC did, said that really, that 6.4 trillion calories out of the food supply really translates to about 90 calories per person per day. So there's still more work to be done. Restaurant sector, I've just done an analysis, and while the calorie are coming down because of the mandatory menu labeling that's going to go into effect in 2017, the restaurant industry has really not made progress with reducing saturated fat and sodium. So my question is, what do you, with all of your experience in the industry, believe is smart legislation, smart policy, smart regulation to create a level playing field so that all these industry players know what the expectations are? Because we really need more accelerated stealth reformulation if we're going to get to those targets.
I'm afraid we're going to have to go to the last question, and then people can give the answers afterwards.
So just one general thought. In all these presentations, the one thing that I was kind of grasping for that I was kind of missing, and I think Eve can maybe, this is more directed for you, around lifestyles and life stages, but also talking about disease burden. So what kind of appropriate nutrition do we need, and what should we be doing as physicians to advocate for patients who are perhaps going through chemotherapy, in addition to their age burden, in addition to their nutrient deficiencies that are going on? How do we reconcile bringing in some of the research and bringing in guidance for the physicians to help? I've watched cancer patients go through chemotherapy with absolutely no guidance from their physicians, and if anything, they're telling them to stay away from multivitamins, and these are people that have nutrient absorption issues, have intake issues, and all kinds of things, and I think that's
Thank you.
missing.
It's an excellent question. You've got 1 minute to answer each of those questions.
Well, I'll answer the first one. We have to have markers of nutritional status as easy and convenient as a blood pressure cuff. And something that is on your phone that when you go to the restaurant, you scan the menu and it tells you exactly what you ate. Without knowledge of what we're eating, we can't make knowledgeable choices. So I think we're hampered by lack of technology at the moment.
So first I'll comment on a couple of comments ago. I agree everyone has a role in helping to support healthy eating. So, the guidelines are one piece of it, but in many cases you know your target population better than we do. And so there is consumer research that needs to be done to be able to communicate to your target audience to address the barriers and challenges to promote healthy eating. So I agree 100%. We all have a role. In terms of the dietary guidelines are developed to help promote health and prevent disease. We don't specifically deal with treatment. And the reason for that, I think we have a role in that conversation, but we do have a number of federal agencies who deal with specific disease outcomes. And so I think it is a conversation of how do we work better with those agencies to help promote healthy eating in various different disease states and in treatment, but we don't deal directly with treatment. So, in terms of helping people with going through chemotherapy have healthy diets and what should those healthy diets look like, I think that's a broader conversation.
Thank you. Okay, I think we better turn it over to Dr. Madani, who's our last. Thank you for a wonderful, provocative, and I think very informative panel.